In this morning's summit rounds, we had a discussion about post-surgical aftercare, which is delivered by a home health service in our community. Actually, we work with several home health companies. And you as a patient may be contacted by the home health service to set up post-surgical aftercare in the home after surgery. And I want to talk a little bit about why we do that and why it's a program that you may choose to participate in. I think that the surgical process, honestly, for a lot of patients is a blur. They come in, they have their clinic appointments, they're told a bunch of things, they come the day of surgery, they're told a couple more things. I always ask them if they have any questions. They almost always don't have any questions. And then they have surgery, and then they go home, and they have a bunch of questions. And the pain sets in, and with some questions and not having answers, and then the pain comes, which is normal in the postoperative period, anxiety ensues. So one of the reasons why we like the patients to stay connected to a care team, and in the immediate postoperative period, a post-surgical aftercare in-home group, is because questions come up, anxieties come up. You wonder, is this pain normal? Is this pain not? What about this specific thing? And you may not have thought to ask that before surgery. You may have thought to ask it before surgery and completely forgot the answer. I don't know. But one of the reasons that we like to have the post-surgical aftercare team available to you is to help coach you through that immediate postoperative period. Our office is always willing to take phone calls. We get a couple hundred phone calls a day. We do our very best to answer them. But honestly, it's difficult for us to get timely responses to every phone call, and the post-surgical aftercare team may be more immediately available to you. So that's one reason, is just that education. We don't want patients to run into a situation where they're not sure what's going on, they're having symptoms, and then they go to the emergency room. Sometimes it's appropriate to go to the emergency room, but most of the time it's not necessary, and it's expensive and time-consuming. Another reason that we do it is a bit of a safety net. Most patients go through the post-surgical period without any major complications, but occasionally somebody has a problem. It's good to recognize the problems early. Having somebody come into the home and check on the patient may identify a problem before it becomes a problem, like a tripping hazard, for example, a safety check in the home. Another thing is maybe there's a brewing problem that's very early in the stage of development that can be identified and treated before it becomes a worse problem, like a wound issue or a swelling in the leg representing a deep venous thrombosis. We want to know about these things early on. The post-surgical aftercare team can help us identify those things for you. Not every patient has to enroll in the service. You may decide to opt out, and that's totally fine. But I wanted patients to know that's why we do the post-surgical aftercare and provide it essentially to every patient that has surgery. It's so that there's an additional layer of education and support for the patients, and to be a safety net for our patients in the case of any postoperative complications.